we're going to look at the ultimate complication of ophthalmic disorders, which is normally visual impairment, and that can result to blindness. So as a definition, we start with low vision, basically, which is a best corrected visual acuity of around 20/70 to 20/200. So to look at it, 20/70 simply refers to you being able to see an image properly at 20 feet in a circumstance where a normal eye will actually see it at 70 feet. And 20/200 will be you being able to see an image properly at 20 feet in a circumstance where a normal eye would actually see it far off at 200 feet. So low vision basically describes visual impairment that requires a patient to have some sort of strategies or devices to help them improve the performance of their visual tasks. So from there, we move to blindness itself, and blindness is basically having a best corrected visual acuity of 20/400. That simply means that even with corrective measures like eyeglasses or contact lenses, you still have a vision of 20/400. So 20/400 simply means that you are able to properly see an image at 20 feet in a circumstance where a normal eye would have seen it from 400 feet. So it is between that range to totally not having any light perception. So when you don't even have any light perception, that we normally term that as absolute blindness. So you'll note that most people, it's not that when you say they are blind, it's not like they cannot see anything at all. Not really. They can be able to see, but blurry or not well-formed images. But sometimes most of the time they have light perception. In the event that they don't have absolute light perception, that means there is total absence of perception of light, then that is what we call absolute blindness. However, from blindness, we can, in different countries, and even from a guide from World Health Organization, there is a state where one is termed as legally blind. Okay, so legal blindness is a condition where you have some impaired vision, but it is placed at when you are having a best corrected visual acuity of around not exceeding 20/200. And that is basically on your better eye. So it is not only the visual acuity of 20/200. You can also have legal blindness if you have some problem with peripheral vision. So when you have peripheral visual loss at an angle of 20 degrees or less, then that also would place you under legal blindness definition. So most of the time, the term legal blindness is used in different countries as a legal marker to actually even place somebody as legally blind, or they can receive financial assistance from the government, or they can be actually termed as disabled in terms of sight. So in terms of distribution, so 90% of visual impairment is mostly found in the low and middle income countries. And as you can see, the dark areas, that is where you have most of the cases. And the reason is, apart from other causes of blindness, you will see infectious diseases are well contribute to this. So things like trachoma, which are communicable, are also factors that can lead to blindness, as well as other things like onchocerciasis. So to cap that off, on top of that, you add things like glaucoma, cataract, and so on. So you find those are conditions that are not well managed in low-income countries. And as a result, the complication leads to visual impairment or blindness. The other more developed countries, they have mechanisms of treating these conditions earlier and better. So proper screening, people go for eye checkup soon enough, so therefore they're able to get these cases lowered. So you'll find that people aged around 50 years and above, they constitute over 80% of those who actually get visual impairment. And in terms of race, African Americans have a higher rate of blindness compared to their Caucasian counterparts. So we delve into the visual impairment types. So first we can have different levels of visual impairment depending on the ability of the person to function or to perform some of the activities. So when we have a visual acuity level between 20/80 to 20/100, basically, together with a visual restriction or peripheral visual restriction of around 60 degrees or greater, then at that point, there's some level of visual impairment, but that's nearly normal level. So in this case, you'll not really even notice. So the visual orientation is near normal, but these people will find that they cannot just scan their environment without moving their head. So they will have to basically keep scanning the environment so that they can be aware of the environment, okay? Because of the limitations of the peripheral vision and also the inability to see as far as a normal eye would have. So the other one is if you have a visual acuity of between now 20/200 to 20/400, and with this, with a 20 degree or greater peripheral visual restriction, so this individual actually has visual impairment that actually can be noted and noticed. So this individual can read slowly with optical aids, and most of the time the visual orientation is low. That means they will constantly need to scan the environment, and they will have to keep moving, okay? Or they will have what we call a travel vision. That means that you'll keep seeing them moving their head for them to actually be able to see their environment. So they cannot just turn their eyes here and there because of the loss of the peripheral vision as well. So they will have to travel or basically move their body or the head to actually be able to see at least. Then if we go now to the extreme where an individual basically has a visual acuity worse than 20/200, as we have seen previously, actually worse than 20/400. And even if you remember the other definitions we talked about, at that point, that is a person who is regarded to be blind. But you see, you can have 20/400, but you have perception of light. So in instances where individuals now with hand motion or no vision, at this case, they benefit from the use of mobility devices and should be encouraged to learn Braille. So these are people who basically cannot see any motion, or even perception to light is almost non-existent. So most of the time you'll find these people need some mobility devices to help them move around, or even Braille to read. So these are World Health Organization categories of visual impairment, and we have talked about some of them. So low vision can be divided into level one, where basically somebody has a visual acuity of 6/18. So, and that simply means somebody will see at 6 meters what a normal eye would have seen at 18 meters. So that is like 0.3 level of visual acuity. Or if you're using feet, that will be 20/70. So if you go further loss of of vision, now we move to level 2, where that person now can only see at 20 feet what a normal eye would have seen at 200 feet. So that is a visual acuity of 20/200. Okay, so things are getting worse. So when you go to now a level where we have 20/400, then that is considered blindness. Okay, so if that gets worse, we get to a point that they can even not perceive light, so there's no light perception. So at that level, we call that absolute blindness. Okay, remember we said most countries will term somebody who has around 20/200 as legally blind. So between 20/200 to 20/400. Okay, so we have, when I started, I said blindness is normally the ultimate complication of most of the visual disorders. So think of most of the conditions. So you can look at medical problems like diabetes. You have diabetic retinopathy. So that can be a condition that can lead to blindness because of the damage of the retina. Okay, then you have macular degeneration, glaucoma, as you remember, the increase in intraocular pressure that compresses on the optic nerve. Then you have opacities on the lens like cataract. Then you have age-related changes, as you have remembered that we said over 80% of the cases are people aged 50 and above. Then you have genetic factors. Then just neurological visual impairment and other problems like retinitis pigmentosa. So these, among others, can actually lead to blindness. So how do we assess this or get some diagnosis? So normally we do some physical assessment. So we can assess distant vision, near vision, and normally we just do this by use of Snell lens chart or just doing a visual acuity test. And we see how far somebody can see. And remember that will give us the visual acuity figure, whether it is 20 over 200, 20 over 100, and so on. Then we can have a field of vision test. Remember we said we want to see the peripheral visual field restriction. And we said when it hits 20 degrees, that is also considered to be legally blind. So as a result, therefore, field of vision test is important. If you have almost just a few specks here and there, you're able to see most of the field of vision, then that's okay. If there's severe visual loss, then that will show that we are heading towards blindness. Then a test of color perception. There's a type of blindness called color blindness. It normally affects men. The men are most prevalent in this condition. And the kind of color blindness that is normally perceived is the red-green blindness. And so they're not able to perceive some certain colors. So that is color blindness. Then we also have a contrast sensitivity test. So you actually brought near an image which has either letters or certain images, and then they are faded as you go along. So we want to see to what extent you can actually see even the faded image. That will bring out the contrast sensitivity test. Then an assessment of visual functioning. So remember we said you can have anywhere along the nervous system that leads to the formation of the image. Remember, image is perceived when the light hits the retina. Up until now, we have the formation of the perception of the image at the visual cortex, which is located basically at the occipital lobe. So anyway, if you have any problem from the optic nerve or from the retina to the optic nerve, optic tract, optic radiation up to the visual cortex, then that most probably will lead to a problem. So assessing that tract to see if there's any problem along it. So most of the time when people have this problem, we have manifestation of eye problems. So you will, in some cases, you will have sudden eye pain, blur or double vision, which is sometimes hazy. You can have red eyes that look inflamed, changes in the color of the iris. Somebody might have some burning and itching sensation, and then unusual or even painful sensitivity to some light. So you remember that blindness, once somebody becomes blind or the visual impairment extends, there's very little we can do. Okay, so we mostly want the patient to be able to cope with their blindness. So mostly we have three aspects we look at: emotional coping. So remember, it's a very traumatic event emotionally. So you want to have a way of talking to the patient, counseling, so that we can be able to cope with the condition. And also teaching them the patient's self-care, as in how to take care of themselves, because that will give them some sort of sense of emotional stability. As well, physical management in terms of making sure that the patient is aware of the environment, like organizing things within their house so they know where everything is. So basically what we talk about spatial orientation. If they are moving out or they are walking, they might need a guide dog or the walking cane that might help them. If they want to read or they want to, so it's good to actually help them learn using brailles. So also social coping in terms of having a supportive group around them. So the family, starting from the family, the friends, or even getting engaged or interacting with other people who have blindness. So emotional adjustment is very important, and actually just helping the patient through this tough time is also important. So thank you very much.